Leukemia. Leukemia is any of several cancers of the bone marrow that prevent the normal manufacture of red and white blood cells and platelets. The result is anemia, increased susceptibility to infection, and impaired blood clotting. The DNA of a normal and healthy cell tells the cell how to properly form, divide, function, and eventually die. The DNA of a cancer cell instructs it to grow and divide at an excessive rate and to continue living past its usefulness. Mutated and diseased cells eventually overtake the healthy cells and crowd them out of the bone marrow, leading to fewer healthy cells. Symptoms vary based on the type of leukemia. They usually consist of fevers or chills, persistent fatigue, weakness, frequent or severe infections, losing weight without trying, swelling lymph nodes, enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds, tiny red spots on the skin, excessive sweating, and bone pain or tenderness. The physical exam consists of looking for pale skin caused by anemia, swelling of the lymph nodes, and enlargement of the liver or spleen. The blood test consists of looking for abnormally high counts of white blood cells or platelets. The bone marrow test consists of a sample being removed from the hip bone using a long, thin needle and being sent to a lab to look for leukemia cells. Types of leukemia include acute, where abnormal blood cells are immature and therefore unable to carry out their normal function; chronic, where there are either too few or too many red blood cells being produced; lymphatic, where the lymphoid cells are affected; and myelogous, where the myeloid cells are affected. The four major forms of leukemia are acute lymphatic leukemia, the most common form found in young children; acute myelogous leukemia, which is found both in adults and children; chronic lymphatic leukemia, the most common chronic form found in adults; and chronic myelogous leukemia, which mostly affects adults. Treatments include chemotherapy, chemicals to kill off leukemia cells; biological therapy to help the immune system recognize and target leukemia cells; targeted therapy to thwart specific mechanisms within the cancer cells; radiation therapy to damage cancer cells and stop their growth; and stem cell transplant to transplant the diseased bone with healthy bone. For acute lymphocytic leukemia, standard treatments include stem cell transplant, targeted drug therapy such as Gleevec, and chemotherapy drugs such as Cytaxan and Rimitrex. The standard treatment for acute myelogenous leukemia includes chemotherapy drugs and stem cell transplant. Standard treatments for chronic lymphocytic leukemia include radiation therapy, targeted therapy drugs such as Zydelig, and chemotherapy drugs including Fludara. The standard treatment for chronic myelogenous leukemia includes stem cell transplant and targeted therapy drugs including Gleevec and Milarion. And now for the case study. 41-year-old male, obese, with a blood pressure of 130/78 and a pulse of 90 beats per minute, suffers from osteoarthritis, obstructive sleep apnea, deep vein thrombosis, and a melanoma 5 years prior. He began to experience fatigue, bleeding gums, and shortness of breath with exertion. Upon visiting his primary care physician, he had a white blood cell count of 40,000 cells per microliter, hemoglobin of 5 grams per deciliter, and a platelet count of 100 billion per liter. He was diagnosed with acute myeloid leukemia. To prepare for his treatment, the patient underwent 4 days of a 50 mg per kilogram regimen of cyclophosphamide and then underwent 4 days of fractionated total body irradiation. On the day of his surgery, he underwent hematopoietic stem cell transplantation. He was started on a daily regimen of 1 mg of tacrolimus and given 15 mg per meter squared of methyltrexate to prevent the rejection of the stem cell transplant. He developed oral candidemia and was started on a regimen for treatment, given an antifungal for oral thrush and valaclovir hydrochloride to prevent herpes simplex complex virus. On days 3, 6, and 11 after his surgery, the patient received 10 mg per meter squared of methyltrexate. 9 days post-op, he developed febrile neutropenia due to an anaerobic bloodstream infection for which antibiotics were administered. The antibiotics caused a severe allergic reaction, rash, and diarrhea. Despite his complications, the patient experienced a white blood cell count and platelet count recovery.
Created using Powtoon.